Good day. I'm following how this pandemic is moving the needle on democracy and economic justice everywhere in the world, including on the continent. I'm worried about lockdowns masquerading as crackdowns in places like Kenya, Nigeria, and Zimbabwe, where security forces have responded with a heavy hand that inevitably most harms the poor majority and the extremely vulnerable. I'm also worried about leaders manipulating the pandemic to enhance their power. It's a problem we're seeing all around the world, including in certain countries in Africa. At the same time, I do see some bright spots in the coordination and leadership from regional African organizations, as well as individual leaders like South African President Cyril Ramaphosa and Ghanaian President Nana Akufo-Addo, who are providing strong leadership and adhering to democratic principles, transparency, and accountability. African civil society and independent media are not only reporting on what isn't working, but they're shaping solutions so we can truly understand the medical, political, and economic impacts of the pandemic and responses to it. Like them, I'm particularly worried about Africa's poor majority in the informal economy, particularly women. We urgently need to upend systemic economic discrimination and inequality. COVID-19 is a slow burn challenge for the continent, forcing us to confront the difference between those who get to be healthy and those who don't. The virus has thus far been slow to spread in Africa, but data makes clear the continent is not immune. As the world fights over diagnostics, protective gear, medical equipment, and access to an eventual vaccine, Africans need and deserve equal access to these essential public goods. I'm heartened by the ways in which African innovators and manufacturers, big and small, have already risen to the challenge to produce their own testing kits, as in Senegal, to manufacture their own personal protective equipment, as in Kenya and South Africa, as well as ventilators, and critically, despite the dearth of funding and other resources, to work on a vaccine, as in Addis Ababa University and the University of Cape Town. But COVID-19 is also already an immediate and urgent challenge for democracy and economic justice in Africa. Africa is grappling with what postponed elections mean for legitimacy and social cohesion. Additionally, many African countries were already on the verge of a sovereign debt crisis. This has pushed them over the edge, just as they most need the fiscal space to respond, recover, and build the kinds of universal health systems that are the surest safeguards against a crisis. Ensuring accessible knowledge as well as supplies and treatments for COVID-19 is critical. The African CDC must be robustly supported to lead, but additionally, mobilizing communities is essential, especially health workers who come from and are accountable to the communities they serve. African leaders have stood together in solidarity around a call for a people's vaccine, a vaccine to eventually be widely available in all countries free of charge. The continent is urging us all to use our collective power to push back on the potential corporate capture of the COVID-19 response. But that doesn't mean we dismiss the importance of the African private sector. Africa needs the capacity to provide an equitable and fair fiscal stimulus for the benefit not only of critical public health and other social services, but also of all its workers. In the end, the challenges in Africa are the same as the rest of the world, and the world has much to learn from Africa. The COVID-19 crisis is fundamentally about creating a more equitable planet, and it's about Africa's ability to stand for itself as an equal partner with the rest of the world. Africa's fight serves both its needs and ours, and I am here for it.